What is acebutolol? Acebutolol is a beta blocker for the treatment of hypertension and arrhythmias, marketed under the brand name Sectral, among others. Acebutolol is a prescription medicine. It's delivered as an oral capsule. As the brand name drug Sectral, and as a generic drug, acebutolol oral capsule is available. In some cases, they might not be available as a brand name drug in all strengths or forms. As part of combination therapy with other drugs, acebutolol can be taken. Acebutolol uses. Acebutolol is used for treating high blood pressure and pulse irregularities, arrhythmia. Lowering the high blood pressure helps you to avoid health conditions such as strokes, kidney complications, and heart attacks. This medication belongs to a class of drugs referred to as beta blockers. It works by blocking the heart and blood vessels from operating on the natural substances in your body, such as epinephrine. This effect decreases heart rate, blood pressure, and heart strain. Forms and strengths. Generic, acebutolol. Form oral capsule. Strengths 200 mg, 400 mg. Brand Sectral. Form oral capsule. Strengths 200 mg, 400 mg. How to use. Take this medication by mouth, as directed by your doctor, with or without food, usually once or twice a day. The dosage is based on your medical condition and your treatment response. To get the most benefit from it, use this medication periodically. To help you recall, take it each day at the same times. It may take several weeks before you get the full benefit of this drug for the treatment of high blood pressure. Even if you feel well, keep on taking this medication. The majority of individuals with high blood pressure do not feel sick. If your condition does not get improved, or if it starts getting worse, tell your doctor, for example if your routine blood pressure readings remain high or increase. How does it work? Acebutolol belongs to a drug class known as beta blockers, a group of medicines that function in the same way as a class of drugs. For the treatment of related conditions/health issues, these medications can also be used. This medication works by blocking hormones, such as adrenaline, from activating certain receptors, beta, located in your blood vessels and heart. Your blood vessels and heart remain relaxed by preventing the activation of these receptors. This helps decrease your pulse and blood pressure. High blood pressure also occurs when you tighten your blood vessels. That strains the heart and boosts the need for oxygen in your body. Acebutolol also helps reduce your heart rate and the demand for oxygen from your heart. Side effects. Some of the common side effects of acarbose are fatigue, dizziness, lightheadedness, nausea, upset stomach, slow heartbeat, sleeping difficulties, fainting, mental/mood changes, reduce blood flow to your hands and feet. If these effects persist or worsen, notify your healthcare provider promptly. When changing positions from sitting or lying down, do so slowly to minimize the risk of dizziness and lightheadedness. Contact your doctor immediately if you experience any serious side effects, including asthma symptoms, chest tightness, shortness of breath, cough, wheezing, heart failure symptoms, shortness of breath, swelling of ankles/feet, unusual tiredness, sudden weight gain. Precautions. Inform your doctor or pharmacist about any allergies or reactions to acebutolol and its inactive ingredients. Discuss your medical history, especially conditions like blood circulation issues, breathing problems, heart conditions, kidney or liver problems, mental/mood disorders, and thyroid disorders. This medication can cause dizziness. Avoid alcohol and cannabis, which can increase dizziness. Acebutolol can mask symptoms of low blood sugar and diabetes. Monitor your blood sugar regularly and report any changes to your doctor. Use during pregnancy only when necessary, as it may affect fetal growth and require monitoring for low blood pressure and slow heartbeat in newborns. Consult your doctor before breastfeeding while using this medication. Interactions. Drug interactions can affect your medication's effectiveness or increase serious side effects. Always consult your doctor before starting, stopping, or changing any medication. Fingolimod can interact with this drug. Discuss with your doctor. Inform your pharmacist about all current medications, including over-the-counter products. Some additives in medications may raise heart rate or blood pressure. Ask your pharmacist for safe usage advice. Acebutolol contraindications. There is a particular group that's not supposed to take acebutolol HCl. With this drug, the conditions below are contraindicated. Check with your doctor if you have any of the following groups: pheochromocytoma, diabetes, depression, myasthenia gravis, a skeletal muscle disorder, complete heart block, second-degree atrioventricular heart block, sinus bradycardia. The efficacy of this drug can be improved by lifestyle improvements such as stress reduction services, exercise, and dietary changes. Speak to your doctor or pharmacist about improvements in your lifestyle that could help you. When taking this drug, monitor your blood pressure and pulse, heart rate, regularly. Learn how to monitor and share the results with your doctor about your blood pressure and pulse at home. Dosage. Overdose. When swallowed, this drug can be harmful. Call or directly go to a poison control center immediately if someone has overdosed and has severe signs such as passing out or difficulty in breathing. Missed dose. If a dose is missing, use it as soon as you know. If it is almost the time for the next dose to be taken is close, skip the forgotten dose. At a normal time, use the next dose. Do not double the dosage. Storage. Store it away from light and moisture at room temperature between 59 to 86 degrees Fahrenheit, 15 to 30 degrees Celsius. You don't freeze. Do not store your medications in the washroom. Do not flush drugs down the toilet or dump them into a drain unless told to do so. Discard this drug correctly when it expires.